Okay, morning everybody. So today's topic is keeping children safe in education 2022. Now, we'll apologise now. This is very much sort of a death by PowerPoint sort of session. I'm happy to sort of take questions as we sort of go through, or happy for anybody to sort of reach out to me after the session as per usual anyway. I've added in some additional pieces of information just for sort of refreshers for anybody and everybody really. But what I would ask is on the back of today's session, I will send around an email survey similar to what we've done previously. This isn't necessarily that sort of knowledge check. It is to understand that we've actually sort of taken the time to actually go through the documentation afterwards, and also that we've picked up the key pieces of information. Obviously, those that have that don't necessarily have that knowledge in there, again, I'm happy to sort of pick up with and go through any sort of structured sessions that we may need to. For this academic year, I have put a plan in place for the safeguarding topics that we're looking to go out there and promote. For September, it is keeping children safe in education 2022 that we'll be looking through. People may join as we go through. What I'm going to do is make a start, because I know this is quite it can be quite time consuming for individuals, but I want to make sure that I don't sort of delay you from getting on to the other tasks as well. Let's say the recordings will be shared afterwards, so if you do need to go back through and recap anything, you'll have those, and all the links to the documentation as well will also be shared. So to get things underway, so safeguarding for all, it is everybody's responsibility. Our role is particularly important. We're in a position to identify concerns. We have some learners that will come to us, or participants or colleagues that are with us for, it could be 6 months, it could be 12 months, it could be, 2 or 3 years. It's a matter of us understanding who they are and what concerns they may be dealing with. It's having that opportunity of people being able to talk to us. What I can say is particularly for the last academic year, we've had an increase in the number of concerns being raised, which is a good thing. It's the fact is that we're developing the rapport, the relationships with our colleagues, also with our learners and our participants, where they feel they can talk to us about these concerns that they may be having and the issues that they may be experiencing, and then we are able to signpost them off to the necessary organisations and make sure that we're keeping in touch and monitoring as well. And I expect that to continue on for this year as well. So just as a refresher for everybody, just in terms of our DSLs and sort of our deputies, so you, as sort of named point of contact, you've got myself, you've got Saj, you've also got Joy. 9 times out of 10 now, communication is through Teams, mobiles, landlines are sort of going out of that window, but it's, we are contactable and accessible in any of those sort of means of ways for individuals that's sort of best suited for them. What I would like to stress is don't leave it till it's too late, so don't wait till you see one of us three sort of walking down a corridor. Please do reach out to us, whether it's email, whether it's a WhatsApp, whether it's a text message, whether it's or any ways of sort of communicating. Please do make sure you're reaching out. It could be nothing, but sometimes it's just that conversation, that person that you can actually speak with. So our responsibility as DSLs there, so that essentially being that designated safeguarding officer for yourselves, is that we need to be available to discuss safeguarding concerns and issues. As I say, it may be nothing, it could be something. Sometimes it is just being able to share that concern. What we generally do in that instance is we do make that written report, so we can start to collate a file. If we have any sort of further concerns, we can add to it as well. It may be relating to a learner, it could be a participant, it could also be a colleague as well. It's our responsibility to ensure that referring to the appropriate agencies, so making sure that if it's a self-referral, that the individual or yourself as well has that supporting information and the right advice and guidance to make that referral, to understand what is the benefit and what support they are going to receive. It's making sure that yourselves and ourselves are also trained up as well, so we will spend time going through CPD activities. We will be sharing information. This could come through the workshops that we conduct for the safeguarding awareness. It can be the newsletters that we share out. It could be information that we're putting through on social media. It could be the content that comes through on the digital screen. So there is many different ways that we're doing this. But what I would stress, if you're ever unsure of anything, please do reach out. I do like to think, particularly for myself, I'm one of those people that is approachable. We can have that confidential conversation. And if it is that piece of training or that bit of advice and guidance that may need relating to, it could be safeguard, it could be absolutely anything. We are here for those sort of conversations. We undertake regular sort of refresher training, myself, various sort of online courses, attending seminars, webinars as well, making sure that we're being equipped with the latest information and then passing this on to yourselves. Ensuring that we've got that adequate reporting system. So at the moment, how the reports come through in terms of the Microsoft form, this is something that we cover on induction. It is a system that is working well at the moment for ourselves. It's then making sure that our safeguarding policies and procedures are up to date. So one thing that we're currently doing is updating our safeguarding policy in line with Keeping Children Safe in 2022. So this would be something that's cascaded and communicated out, most likely at one of our staff huddles very soon, but then we'll also run additional workshops just to make sure everybody has the understanding of what it means to them, really, essentially what it is that we're doing now. Also, it's our sort of duty to ensure that we're complying with local authority requirements. So each of the areas that we sort of operate in all have their own sort of local authority, which means they have their own designated officer. They all can work in different ways. So it's a matter of us having that information available and then making sure that we're reporting in the appropriate manner as well. For us, it's making sure that we're also have that sufficient safer recruitment process, and we will cover safer recruitment as we go through, and it is things that we're picking up as part of our sort of awareness sessions, particularly for those that are conducting interviews and doing recruitment at the moment. It's also for us to be aware of those individuals who have those specific safeguards. So where we're creating that concern is that we need to have that record and to show that we are sort of monitoring and we're aware of that situation. In addition to ourselves, we've also got our senior leadership team and our management team. They're there to support you. It's crucial for us that we've got that full culture of safeguarding, so it's supporting the whole of the organisation, making sure that we've all have the right understanding, we understand how it's being implemented, how we're addressing those issues, what themes are out there, what behaviours we need to be aware of, and what that knowledge is that we need to have. Again, if anyone is ever unsure of, what actually safeguarding is, what we're meant to be doing at any time, again, you can come to me, myself, Saj, Joy, even the senior leadership team and the management team there. They are there to support you. They're there to obviously seek that advice and support. Individuals will have previous experiences, they will have various training and knowledge as well when it comes to safeguarding. If they're ever unsure, they obviously have the three of us to sort of fall back to as well. But it is very much there. We're in this together. Safeguarding is everybody's responsibility. So in case you're not aware, our senior leadership team, this information is readily available on the website under our team section. So you'll see there, so you've got from CEO to chair down to our heads of within the departments as well. Most likely it is your direct line manager. Hopefully their photos displayed on here. They are, again, there to support you when it comes to safeguarding. It's making sure that we're having that written report that sort of ultimately comes through, but these are individuals that you can go to for that advice and support that you may need to react and act accordingly. So I just wanted to take the opportunity as well, just to mention again our code of conduct. So this is something we brought up at the all staff huddle for August. It is crucial. This does form part of Keeping Children Safe in Education 2022 as well. Essentially, how we're there to sort of conduct ourselves in that professional manner. I'm not going to take the time to go through each of it by line. These will be in the slides, and again, it is something on the website which I'll show you how to access after this session as well. So the statutory guidance that we've had released, so as of the 1st of September, so last week, this came into effect for us to be aware of, hence why we're running this training session for yourselves now. It is an update to the 2021, so those that did attend the previous session, there is sort of key terminology that's sort of updated in there, and we were looking to sort of go through some of those. I have tailored towards today's session for people that may not necessarily be aware of the previous reiterations of it, and then also for us to sort of run this training on a regular basis, just so when new starters come through, we can ensure they've got the right understanding in terms of the statutory guidance for ourselves. So safeguarding information for schools and colleges for staff. Now, sometimes I do have sort of people come back to me in terms of the terminology within Keeping Children Safe in Education. First of all, we don't work with children. Well, actually we do. The definition is up to the age of 18. What I see this as being is good practice for us to have within all of our provisions, really, in terms of identifying the trends, behaviours, and having that level of knowledge. Some people will sort of often come back and say, well, we're not a school or a college. That may be correct in sort of terminology, but we're still working potentially with those young people. So those sort of 16 to sort of 18-year-olds that we have come through the doors. I know we also do further engagement. We obviously do sessions and information sessions where we're working with school children as well. This is making sure that we're doing anything and everything we can to keep people that we're working with safe. As I say, it refers to and comes in as being good practice for us to apply to anybody and everybody in terms of keeping them safe and providing them a safe learning environment. Again, with some of our learners, they may have children. So where we find there are potential safeguarding issues, it may be that we have that duty of care that comes into line, and we need to make a necessary report to the likes of local authorities or emergency services because there is a child involved in that situation. This gives us that overview, understanding of when we should be sort of taking actions and making those necessary disclosures. So the role of the school and sort of college staff, so it's down to us to make sure that we're promoting the welfare, not just necessarily of children, it's of everybody's responsibility. Everybody that comes into contact has an important role to play. So this is where some people, as I mentioned, where they say, well, actually, we don't work with children, use that word as being that young person, but it could be a learner, it could be a participant, it can also be a colleague as well. Our role is particularly important. We have people that will come through our doors, and they're not just with us for one appointment. It will be a long period of time. We do get to know these individuals. We'll potentially we understand what their welfare situation is. What we're there to do is to prevent those concerns sort of escalating further. It is making sure that we're making that record, and we're able to monitor and give them that support. Sometimes it could be nothing, but sometimes there could be something there, and it's making sure that we're giving that support. Some of those individuals that don't directly engage with the young people or our participants or some colleagues, they're still playing that effective part when it comes to protecting individuals. It's having that awareness and alertness to a lot of the signs, the concerns, really. So what they essentially need to know, the purpose of safeguarding, again, this is specifying that anybody under the age of 18, so they are classification of a child. We're looking at this on a wider scale in terms of making sure that we're able to support it. Anybody and everybody that sort of comes through our doors, whether it's a colleague or it's an apprentice or it's a learner. Safeguarding is there for promoting that welfare of individuals, protecting them from maltreatment, preventing the impairment of children's sort of mental and physical health and development, ensuring people grow up in sort of consistent circumstances, really. They're in safety. They've also got that effective care, and taking action to ensure that anybody and everybody has those sort of best outcomes, really. And I'm sure we could all agree on those couple of statements there. All staff should be aware of the systems that we have in relation to safeguarding. There are a number of areas when it comes to sort of safeguarding. We will explore some of those as we go through. Just to name a few, obviously we have the likes of our safeguarding policy, which is available on the website. It's also available through the likes of SharePoint and People HR. It is there making sure that we're aware of this. We have sort of overhauled our induction when it comes to particularly through safeguarding. Not only has the sort of session got more in depth, but it is sort of trying to promote those sort of conversation discussions to make sure that where we're not just sort of doing death by PowerPoint, that people are being able to engage and have contribution to it as well, because it makes it a more meaningful learning experience for them as well. We are setting out our policies, procedures when it comes to induction. Something that we'll be looking at towards the end of this session, again, is just that reminder of where you can access these as well. Receiving the appropriate training. So again, with our safeguarding awareness sessions, we're doing the newsletters that sort of go out, bringing them up at the staff huddle as well. It's doing anything and everything that we can. We don't just want it to be all online. So where we're looking at sort of team meetings, we're looking for the likes of our delivery managers to be conducting those sort of conversations, not just focus around what's happening in the centre, but the bigger picture in terms of the local area as well. What trends, what do they need to be aware of, and how do we best share that information to them as well? It's crucially important that you know who your designated safeguarding leads are as well. So people you can go to for support. We've covered that in introduction, and we will also look to sort of check that knowledge as well as we take the next steps after today as well. All staff should know, essentially it's collecting that information, know what to do if someone does say that they're being abused or neglected. There will be sessions that we've run previously in terms of dealing with those concerns, and it will be something that we continue to run with as well. It's making sure that we're not sort of promising that we can never tell anybody else that it sort of happened, because we have that duty of care, particularly where it refers to a child or a young person at that point. We need to be in a position where all staff should be able to reassure potential victims that things will be taken seriously, and information will be kept safe. They should never be given that impression that that they're actually creating a problem by reporting that as well. We all need to be aware as well that technology is a significant component when it comes to safeguarding and wellbeing issues. More and more now, we're having reports of the likes of cyberbullying that is sort of taking place online, people sort of being catfished, and these are all things that sort of take place online, but can really lead to an offline sort of situation, and it could be different forms of abuse and harassment that they can sort of receive as well. So it is making sure that we've got that awareness. As I say, these will be forming part of the workshops that we look to do sort of running forward to coincide what we have run previously as well. So what do we need to actually look out for? So as we've covered in previous sessions, and probably what we were aware from previous training as well, safeguarding concerns can come in a number of different sort of shapes and sizes. We're not here today to look through those on a case-by-case basis. But what we are here to look at is the likes of abuse and neglect. So it's knowing what to look out for, those sort of vital early signs. So as I've mentioned, where we have individuals that sort of come on and work with us, whether it's 6 months, 12 months, 24 months, we get to know those individuals quite well. There will be sort of signs and indicators, and it could be sort of signs that they're being abused, neglected, or exploitation. It could be that they're sort of changing behaviours, absenteeism as well, that sort of come into it, and we will take another look in just a moment at some of those examples where we look at children particularly, but they can be applied to an adult situation. Abuse can take wholly online or sort of using technology, so that is something that we need to be aware of. However, it can also happen in that sort of offline, in physical, which obviously means it's a different type of abuse and sort of category as well. If staff are unsure of any of it, of how to categorise it and what is going on, that's where it is coming to speak to whether it's the likes of the management team, the leadership team, or the DSLs. We are here to sort of listen to those concerns and provide that advice and support. So in terms of early help, things that to sort of look out for. So we have obviously, so from individuals, it could be, that sort of disability that puts them on a more vulnerable sort of position. We have the requirements in terms of mental health. It could be a young carer. They could be showing signs of being drawn into antisocial or criminal behaviour. There we have the sort of leading to the likes of county lines, which again we've covered sessions on it before, but we'll look to refresh those as we go forward. It could be individuals that often go missing from being within care or from their home. It could be at risk of going into modern slavery, trafficking, sexual exploitation, criminal exploitation as well, being radicalised or exploited. There could be family members where they're in prison, or there's parental offending that is taking place as well. Could be family circumstances. There could be drug and alcohol substance misuse sort of within the household or by that individual. They could be sort of being returned home from or from a sort of caring environment as well, which moves us into things like the honour-based abuse. It could be FGM, there could be forced marriage, there could be private fostering that's taking place. There could be persistent absence from the likes of education as well. That these are sort of indicators that we need to be aware of. So what I will do is share these slides and the recordings so anybody can sort of recap and revisit any of the information, but there is this plus a lot more within the Keeping Children Safe 2022 documentation, which I will also share with you as well after. So when we look at or try and start categorising forms of abuse and neglect, so you've got generally abuse, which is a form of maltreatment of that individual. It could be that somebody maybe abusing or neglecting them, inflicting harm, failing to prevent harm. We have seen this in a number of the sort of the young people that have died at the hands of parents sort of in recent years. This type of abuse that can actually come through. There is physical abuse, where it could involve sort of hitting or shaking or throwing, poisoning, burning, scalding individuals in some cases. You then have emotional abuse, where it's that emotional maltreatment of sort of that young person or adult as well. It could be where they're sort of being spoken to in a derogatory manner, worthlessness, unloved, inadequate levels of care and sort of compassion shown to them. You've then got elements of neglect, where it's essentially that persistent failure to meet the basic and physical, psychological needs, which can sort of hinder development and health and well-being for that individual at the same time. We then have sexual abuse, involves enforcing, enacting children or young people to take part in sort of sexual activities. It could be physical contact. It can also be perpetrated through online activity as well. It could be the sharing of inappropriate content to a young person, encouraging the children to behave in that inappropriate manner. These are things that we need to be aware of, and again, the forms of abuse and neglect and how they're categorised as well. All staff need to be aware that the child sexual and child sexual exploitation are forms of child abuse. So again, it's knowing where ultimately we go for the advice and information. If we was to have these concerns, there are specialist organisations. Obviously, we would go through the likes of the local authorities, alerting police as well. But then there are supporting organisations that can provide us with support. But again, also the individuals that have essentially the victims as well. So they're the sort of outlining abuse, neglect, the different sort of categorisations. There are a number of different other safeguarding issues. More recently, and something that we need to be aware of, is the issues that could put children at risk of harm. Behaviours linked to the use of drink and drug, deliberately missing education, serious violence, that could be connected with the likes of County Alliance as well. That radicalisation, consensual or non-consensual, of sharing semi-nude images. So we have previously looked at the likes of sexting. These are things that we need to be aware of and sort of at the forefront of our mind, really. We have to have that mentality, is that this could be happening here, and be able to sort of promote and share and support those individuals that may come victim or being drawn into various activities. One of the big changes within Keeping Children Safe was the term peer-on-peer abuse. It has now been renamed to child-on-child abuse. This is essentially where a child can abuse another child of any age. It could be sexually motivated, it could be physical, it could be elements of neglect that are put into it as well. But the categorisation is child-on-child abuse, and it is sort of handled and dealt with in a slightly different way than the others. One that we won't necessarily go into here, but it's something that we need to be aware of and understand. We need to ensure that we've got a clear understanding of from our safeguarding policy, what does that look like, how do we categorise it ourselves, and what advice and support do we put in place. So as I say, where we're currently evaluating our safeguarding policy, there will be an update, and there will be that sharing of that information. So there will be a follow-up to particularly for child-on-child abuse sort of moving forward. It's most likely to include, but not necessarily limited to, the likes of bullying. It could be cyberbullying as well, prejudice. It could be discriminatory bullying as well that taking place. It could be abuse within intimate personal relationships. It could be within that teenage relationship. Again, sort of moving forward, you've got physical abuse. It could be hitting, kicking, spitting, burning, essentially causing physical harm to another individual. You've got sexual violence such as rape, assault, penetration, and sexual assault that all comes into it. And again, where you've got the likes of sexual harassment, sexual comments, remarks, jokes online, sexual harassment. And I know one of the workshops I went on to before, it was sort of, well, why wasn't this included before? It is unfortunately just how times are changing and evolving, and we do need to sort of further classify and review how we are sort of essentially categorizing and then sort of responding and dealing with the types of these concerns. So it is something that has been there, but with this essentially being on an increase within sort of school environments, we certainly need to be aware and vigilant and making sure that we're responding to these concerns as well. So what schools and colleges staff should do if we have concerns about a child? Well, it's staff working with children or those individuals, maintain the attitude of essentially it could happen here. So this is where we're looking at that child-on-child abuse, where in terms of that safeguarding approach, when we have that concern of a child, that individual, we've got to ensure that we're acting in the best interest of that individual. So it's not to sort of ignore it and to allow it to carry on. It could be nothing, but it could be something. Sometimes it may just be that we need to sort of raise that concern or share that concern with somebody else, and it starts to triangulate a picture of exactly what is going on there. We shouldn't just assume that somebody else is essentially going to deal with it. One thing I do generally point out, particularly from an induction point of view, although we have named DSLs in place, we can't be out in the field at all times. It is down to safeguarding being everybody's responsibility. It's having that triangulated picture that we're there to support and work together really. If staff do have concerns about an individual's welfare, you should be acting on it immediately. You could be having that conversation with your line manager to say, I've got concerns about an individual, sharing those concerns. And it may be that at that point we begin to monitoring it. But it's a matter of starting to have those sort of conversations. Where needed, us as designated safeguarding leads will lead on those next steps. If we have sort of a further concern that is raised, or we've got that sort of serious concern, it's where we then look to bring over into whether it's a local authority we need to engage with or outside services or emergency services in some cases. So why is all this important? It's important that people receive the right help at the right time to address those safeguarding risks and prevent those sort of issues from escalating and promoting their welfare. There are always research and serious case reviews that are taking place. Some of those is what we've looked at in previous sessions. Essentially, it's where dangers have been highlighted, but then potentially not effective measures haven't been taken, which has ultimately led to sort of the death or serious injury of some individuals. We've got to make sure that we have that good practice. So poor practice could be failing to listen to views of others, failing to reassess the concerns of the situations if they're not improving, sharing the information too slowly. A lack of challenge to those who appear not to be taking sort of essentially that action earlier. So it is a matter of raising those concerns and having that passion and interest. As I mentioned earlier on, we've had an increase in the number of concerns we've had raised. So I know these sort of conversations are sort of taking place. The concerns are being shared as well. To me, that it's good and it's showing that culture of safeguarding is really developing for ourselves. So what should we do if we have concerns or an allegation about a member of staff who may pose a risk of harm? So as I say, with our safeguarding policy, this is an area that we're currently reviewing. What we would look to do is obviously depending on that individual that would potentially be posing that risk. So if it was a member of the safeguarding team, then obviously there would be sort of advice for further alternative steps to sort of take place. But it is a matter of reporting to to an individual that you feel that you can go to with this as a concern is the main part. It could be an alternative member of essentially the senior leadership team or a management team, but making sure that it's at an appropriate level and that concern is listened to. Really, we do obviously have the likes of our whistleblowing policy that has recently been sort of refreshed and sort of pushed out as well. That's available through our SharePoint, so you can obviously sort of familiarise yourself through there as well. So if anybody was to have concerns about safeguarding practices within the organisation, you should feel that you're able to raise those concerns about poor or unsafe practices. So whether that's coming straight through to a member of the safeguarding team, or again the likes of the leadership team, raising that concern to make sure that where improvements can be made. We do essentially have that open door policy here. We do also have internal challenge as well, which I think is a good thing for ourselves. So it's making sure that we're able to do something about it. You can see on the screen as well, there is mention of that whistleblowing policy, that procedure. Again, that is something that is in place and something that can be raised as well. In addition, there are outside organisations. The information here obviously refers to the NSPCC, but again, because we have individuals that may fall into that scope, they are an organisation that would there be to respond and also support us to ensure that our safeguarding measures are in place. But that's what you can do if you felt that safeguarding practices weren't up to an effective standard. So what we have within the Keeping Children Safe is we have this part 1 section. This is something that I will be emailing around to everybody and also seeking confirmation that you've also read it. There will be some simple questions or straightforward questions on there as well, just to confirm that you're familiar with the information in there. It's important for us to react and be proactive in terms of raising the awareness of welfare, and that we need to ensure that where we have a concern about an individual, that we're acting on it immediately. As I say, it could be reporting it with the line manager to make sure that we've got it on the radar and we're able to do something about it. Again, you've got the likes of myself, Saj and Joy that is available to talk to anyone and everyone in regards to safeguarding concerns, but just understand that you do also have the likes of your line managers and also teams within the leadership team as well, and management team there to support you. Where a child or an individual is suffering or likely to suffer from harm, it's important that a referral to the local authority is completed. In many cases, for ourselves, where we're dealing with adults, it could also be the likes of the emergency services. It very much depends on that safeguarding situation that may be unfolding and that you're dealing with at that time. So the different types of safeguarding issues that we all need to be aware of. So as I say, we've previously done workshops in the safeguarding awareness sessions in these. We've also done elements of our staff huddles as well. There is unfortunately a whole number of potential concerns that we need to be aware of, or safeguarding issues. This ranges from the likes of forced marriage. It's things like FGM. There could be modern slavery, domestic abuse, channel, prevent. There is a whole raft, and I say there are these are scheduled to be workshops that we look to cover. Some of these which we've already covered previously, and I'll show you also how to access some of those materials as well. So if you do want to refresh yourself, the recordings as well can be available. For myself, I just wanted to highlight in terms of record keeping. So all concerns, discussions, and decisions made, and the reasons for those decisions should be recorded in writing. So we have our safeguarding reporting form, which hopefully we're all familiar with. But again, I will cover on how to access that just at the end of the session. That information needs to be kept confidentially and secured. Stored securely. That's something that we have in place at the moment, but it is making sure that we're getting those concerns completed in writing to us. Sometimes, as I say, it can be a Teams conversation, it can be a Teams message that sort of comes through to say I've got this concern, but it is making sure that we're going through that necessary reporting procedure. We're looking for that clear and comprehensive summary of that concern. So what is that situation that's happened? Details on how the concern was followed up. For myself, it's how then it's resolved, what ongoing support is sort of recorded as well. I need to be able to record the action, any action that's sort of taken, the decisions reached, and what that outcome is at the moment. If in doubt about any of how we record this or the information that we're looking to have, please do just pick up the phone or ask that question. So what information is it you need? We do have the set template, and I think it is quite self-explanatory, but more the better in many ways in terms of information, but it is just making sure that it is clear and comprehensive on what has happened and what support we can look to, so we can ascertain what support we can move forward with. I did mention at the start that there is a mention of safer recruitment. So we have previously sort of revisited safer recruitment ourselves with our senior management team. It probably is something that we are sort of looking to refresh as well. Keeping children safe in Education 22 gives us that legal requirement. So essentially our must do when it comes to recruitment. So it could be looking at the recruitment and selection process, the pre-appointment, the vetting, the regulated activities, recording the information, the other checks that we may be doing on, for our staff. It could be things like their DBS. It could also be the referencing as well. And it's how we're also sort of giving them that ongoing support, making sure that we remain compliant when it comes to safeguarding. What I have found in there is a lot of things that are considered best practice. And the good thing is that there is an update in there from last year as well. So there are more improvements that we could be looking to implement across the provision ourselves. For us, it's good to talk. I summarise safeguarding as being a means to protect people from harm, abuse, and neglect. It is there. We're there to sort of protect people's health and well-being, the human rights. We're there to support adults, young people, whether they're participants, their colleagues. We want them to come in and live, learn, and work in safety, free from abuse, harm, and neglect. It's about us as people working together with organisations to make sure we're preventing and reducing the opportunities of harm, abuse, and neglect taking place. We can only do that when conversations are taking place and we're working together. We do have on the website, obviously, pathwaygroup.co.uk/safeguard. On this section, there is a whole number of sort of organisations that we can be referring to. So if I just bring it up for one moment. So those that have been through the induction very, very recently, you will find that I, constantly mentioned about this part of the website. There's a lot of information in here. You can access it via the home section just here, or you can access it through the contact us and safeguard. Also the QR codes that we have on the screens and the posters where we have support, it does take people onto this website. So not only do you get contact details for myself, Joy, and Saj, you'll see safeguarding topics. So these are previous sessions that we've run. So what we've done previously for self-harm, domestic abuse, keeping children safe in education, statutory guidance, British values. There are other pieces behind here as well that you can use, whether it's for delivery material, but also then to refresh yourself as well. You've then got the safeguarding reporting form, which you can access through on here. And as I say, it's that Microsoft form that triggers off the text message and email notification. We've got our current safeguarding policy as well that you can access. As I say, this is being re-evaluated and we'll do the relaunch very shortly. And then you've also got the Keeping Children Safe in Education 2022 framework. On the website here, you've got the full 179-page document here, but it is that 43 pages that we need to ensure that people are aware of. You can download it. I wouldn't necessarily recommend printing it unless you're going to refer back to it over and over again. But I have put these copies straight onto the website to make it of ease of use and accessibility for people. Very much, where do people find, where can people find help? Now, I did have in the induction previously, how can people get help outside of the office hours? Well, if we're unable to take their call or text message or anything like that, if we're pushing and promoting the pathwaygroup.co.uk/safeguard to individuals, there are over 100 organisations within this sort of mixture here where people can get advice and support. So it may not be something that we're immediately able to sort of support them with, but if safe, it's a matter of sort of pointing them off to a resource site. There is that information on there. Also for yourselves, where you are working with individuals and it may be certain things that you're looking to support them with, there will be a category on here. Previously we did have one for bipolar, so we did the research, we found the organisation, we've put the details on there. Things with bereavement, abuse, whether it's from domestic or child or sexual, there are organisations that are out there to sort of support as well. It's a matter of using the resource and the information that we've got available, really. Okay, so without further ado, I'm happy to say that is the end of today's session. As I say, there will be the recording that I will share out to everybody on email this afternoon, along with the links to the necessary documents. The documents are available on pathwaygroup.co.uk/safeguard, and you can access them straight through on here. I will put together sort of a question survey just to ensure that we've got the right understanding when it comes to safeguarding, along with keeping children safe in education as well. And enjoy the rest of your days, really. Thank you.
Thank you.
Thank you.
Thanks,
Thank you.
Martin.
Thanks,
Thank you.
Thanks,
you,
Martin.
Thanks, Martin.